second presentation is Dr. Eric Larsen from the Children's Oncology Group. Eric.
Good afternoon. Thank you very much for the opportunity to present some of our work from the Children's Oncology Group. This afternoon I'll be talking about outcome in adolescent and young adult patients, also known as AYA patients, and I'll define that in just a minute. Outcome in AYA patients compared to younger patients treated for high-risk B-precursor acute lymphoblastic leukemia. And this is a report from the Children's Oncology Group study AALL0232. So in terms of background, historically AYA patients, and pretty consistently AYA patients have been defined as those patients who are 16 years and greater with ALL have an inferior outcome compared to younger patients aged 1 through 15 years old. This is a consistent finding in any observation you'll see in ALL. This is due to both higher rates of relapse and higher rates of toxicity. There are many potential reasons to explain this phenomenon, including differences in disease biology. There's evolving data that shows quite strongly that older patients with ALL are more likely to have unfavorable molecular characteristics to their leukemia cells. Differences in host factors. It's been observed for years that older patients tolerate chemotherapy not as well as younger patients and have much more side effects. And the result of this is older patients tend to not be able to tolerate full-dose chemotherapy for the duration of a research protocol. So they have compromised therapy because of that. And related to this, there are differences in treatment. If you look at treatment protocols for older patients with ALL compared to younger patients with ALL, the protocols for older patients tend to be not as intensive, both in terms of number of drugs and also drug dosages and duration of therapy. And finally, there are complex socioeconomic factors that we're just beginning to understand that may play a role and may explain some of these differences in outcome between AYA patients and the younger patients. Within this group, one factor we're starting to understand a little bit more is compliance with oral chemotherapy. Whereas a lot of the early treatment for an individual with ALL involves intravenous administration of chemotherapy. Later on in therapy during maintenance, it's all oral and patients are taking chemotherapy at home. And there's very strong data now suggesting that older patients are much less compliant with their oral chemotherapy, and there's also good evidence that low compliance correlates with higher relapse rates. So all these factors together explain the differences in outcome between these two patient groups. The protocol, AALL0232, was specifically designed to test a more potent steroid, that is dexamethasone as compared to prednisone, and it was also to test a higher dose of methotrexate. Both these were in the interest of intensifying therapy to increase cure rates in all children and young adults with ALL. In contrast to earlier studies for ALL, which historically had an upper age limit of 18, more recently had an upper age limit of 21. This protocol was the first protocol that increased that age limit up to the age 30, so we accepted patients between 1 and age 30. Overall, there were over 2,500 patients eligible and evaluable who were ultimately randomized, and pertinent to today's discussion, 500 of these patients, or 20%, were in fact met the definition as being AYA patients at the time of enrollment. Previous observations about the outcome of AYA patients are usually comparing one trial to another. And on this trial, we had large numbers of patients within getting the same treatment on the same trial to allow for comparison. Of note, the results of the dexamethasone administration and the high-dose methotrexate were presented at ASCO last year. This slide summarizes the treatment failures. In the first column, we have various events. The second column is 5-year cumulative incidence of each event for the younger patients, that is patients less than 16. The third column is the 5-year incidence for the AYA patients, and then we've calculated p-values for statistical significance in the last column. So if we just look at relapse, the younger patients had a 5-year cumulative incidence of relapse overall of 13% compared to 21%, and this reached statistical significance at 0.002. There are two basic ways you can relapse. One is in your bone marrow and one is in your CNS. And when we dissected this out more closely, when we look at marrow relapse, again, there was a difference with 9% of the younger patients having marrow relapse compared to 15 in the AYA patients, and again, this reached statistical significance. However, interestingly, CNS relapse, there was a trend towards higher CNS relapse rates in the older patients, but it did not reach statistical significance. Another important observation of this trial, which is consistent with previous observations, is the rate of remission death in patients was significantly higher in the AYA population, 5.5 to 2.1%, and this was highly significant. To summarize this data visually, in this Kaplan-Meier curve, which on the vertical axis gives us percentage of patients who have event-free survival, that is, they're alive and they haven't relapsed, compared to years. The upper solid line are our younger patients, less than 16. The lower curve, the dotted line, is the AYA patients, and you can see these curves diverge pretty much right from the beginning, and they continue to diverge out such that at 5 years, the younger patients have an event-free survival of 80% compared to 68% in the AYA patients. So in summary, compared to previous trials, the AYA patients on this trial, in fact, had improved outcome compared to historical trials. Previous trials range anywhere from 50 to 60% event-free survival, and on this trial, AYA patients had an event-free survival of 68%. However, compared to the younger patients, AYA patients treated on this protocol had worse outcome with higher rates of marrow relapse and also higher rates of remission death. As we look to the future strategies to improve outcome in AYA patients with ALL should focus on both better leukemia control, that is more intensification of therapy, and also attempts to reduce treatment toxicity. Thank you for your attention.